In the greater Cedar Rapids community, Progressive Rehabilitation Medicine provides advanced, non-surgical pain management solutions, such as physical restorative therapy, ultrasound-guided intervention, pulse electromagnetic field therapy, electrodiagnostic medicine, and deep tissue laser therapy.
By the time they get to our clinic, they have essentially failed all conservative measures before. It could be trigger point injections, acupuncture, medications, massage, physical therapy, any of those offshoots, cupping, stretching, any of that, epidurals. So most of the time they've already tried and failed all of those things. So we're kind of their last hope on what they want.
At Progressive Rehabilitation in Cedar Rapids, our most popular therapies are the hyperbaric oxygen chamber therapy, regenerative biologics, in true non-surgical spinal decompression, utilizing the DRX 9000.
We are proud to have evidence-based technologies such as the DRX 9000, which have studies done on it, done by doctors from Johns Hopkins, Mayo, Stanford University, among other prestigious universities, which support its claims.
You know, I can't sleep on my back, I can't sleep on my stomach, I have excruciating pain. And I'm a nurse, and so, you know, doctors just want to give you oxycodone or codeine, and I would refuse to take that because I had to function, you know. And so I would take tons of ibuprofen all the time, and I just learned to kind of live with the pain. And at the beginning, you know, I was a little, I guess a little fearful, because everybody is, of the unknown. But when they put me in that harness and I was up there, I was expecting, you know, severe pain, but praise God I didn't, you know, and I felt on the second day, I felt, you know, people think, really, on the second day you felt something better? But I did. I really honestly did.
Dr. Sunny Kim is board certified in physical medicine and rehabilitation and is an alumni of the prestigious Cornell University, Johns Hopkins School of Medicine, and Rutgers Medical School. Dr. Kim is the first DRX 9000 certified provider in the great state of Iowa.
The DRX 9000 pulls on the spine using logarithmic curve, which is a type of pull that's been proven under scientific scrutiny to be able to achieve true decompression. And that study was published in the Journal of Neurosurgery by Dr. Ramos and Martin.
I've been treating patients with DRX 9000 for approximately 20 years. And I've been very impressed with the clinical results. 90% of the patients are significantly improved.
When I finally got the MRI and I realized that I had an L4, L5 herniation, I was really dragging my leg around and having a hard time sitting, having a hard time driving. I was in excruciating pain. I was just in a lot of pain, and I thought, well, let me figure out what medicines I can take. I was hoping that it would just go away. The last thing I want to do is surgery. That would be my last choice. And we started the DRX 9000 treatments, and most of the symptoms were gone after a couple of weeks being on the machine. It worked almost immediately, for me at least. This treatment's been a lifesaver for me. I'm able to come back and work without any limitations anymore. Having surgery is a big deal. This was non-surgical. This is something I could do for 30 minutes, you know, a day, and it showed a great improvement. We've been able to get most of my symptoms away, and I'm back to work.
One of the features of the DRX 9000 which allows us to be successful in treating difficult spinal conditions, is the ability to very precisely change the angle of pull to target a specific disc level in the neck or in the lower back, so that you get targeted decompression of the area of the spine that needs most attention.
But they've gone from a pain level of 9 to maybe 1 or 2 or something like that. A lot of them are asymptomatic. And it's very impressive. Does that treatment last? Yes, it lasts. And so I have a lot of patients. I never see them again. And some of them had large extruded herniated discs with blockage of the central canal, and they're back doing even normal activity. I've treated over 1,000 patients with both the lumbar and cervical DRX 9000 unit. And the improvement is seen in all areas. So the DRX machine will help pull the disc back in, help increase the height of the disc space, help improve the space of the spinal cord and the spinal nerves going through what's called the central spinal canal, and help decrease central spinal canal stenosis, primarily by getting the disc to move back where it belongs.
What really drives us here at Progressive Rehabilitation Medicine is getting to the root cause of the problem and offering specialized treatment technologies that actually work. And our goal is to reduce pain and suffering, reduce disability, get people back to work, and improve quality of life. And what really drives us and motivates us is seeing the successes. People who could not walk, walking again. People who were literally in their bed all day long and now walking 1-2 miles a day. This is an astounding feat. And there's limitations from traditional medicine. Traditional medicine is often driven by pharmaceuticals. Many of the drugs are habit forming, like the opioid. There's a opioid epidemic out there. And we've learned over the years that that's not a good thing. It's actually causing more problems than good. Traditional medicine likes to do a lot of surgeries, but we've discovered ways to treat the body in such a way as to tap into the inner natural ability of the body to heal and avoid unnecessary surgeries, avoid potentially habit-forming and harmful pills, drugs, and chemicals. But what really drives us is being able to see the successes from all the hard work, from traveling around the world, from working with some of the top doctors and other medical providers. We've been able to harness the best technologies and bring it all under one roof to get the best possible results.
Have you been struggling with back or neck pain, maybe considering an invasive surgical procedure? Do you wonder if there's something more conservative that could be tried first? Due to the overwhelming success, we've moved our office to accommodate even more spinal decompression equipment.
I'll never forget the day that I walked outside and I thought, I'm standing up straight. I feel taller and my back doesn't hurt. This is great.
Give us a call to schedule your free consultation and MRI review at our new location to see if decompression therapy can help. It could change your life.
Hi, I'm Sheila Boisvert, and my husband, Dr. Leo Boisvert, and I both own Today Disc, Bone, and Joint Chiropractic Treatment Center. You know, from the very beginning, our goal is to ease the pain. We have so many potential patients that come in because they've done it all. Many of them have had the injections. Many of them have done physical therapy. So many, unfortunately, have had back surgery. But whatever it is, when they come in, so many times they're at the end of their rope. Well, we're here to help, whether they're at the end of their rope or we're the first stop, because they know and they've heard from experience that we truly do care and we have what it takes to heal the disc. Well, that's where the spinal decompression DRX 9000 comes in. You see, when someone gives us the opportunity and they come in, they'll sit face to face, knee to knee, eye to eye with one of our doctors, whether it's Dr. Leo or one of our other doctors on staff. We'll look at the imaging if they have it. If not, we'll do imaging here, right here in our facility. They'll look at it, They'll examine the patient. They're of course going to listen to the difficulties that they've had. It might be that they're unable to go on the walks with their spouse that they've enjoyed for so long. It might be that they just can't sit for very long. They can't drive from one location to the other very long because of the pain that radiates down their hip and into their leg. It might be that they're a 20-something-year-old and they hurt themselves in a physical activity, some athletic activity. But whatever the case is, we're going to listen. We're going to look at the imaging if we have it. If not, like I said, we're going to do the imaging here. But after that, then so many times, once that we build your trust, once that we have your trust that we truly can heal your disc, then hey, take a trial on the spinal decompression, the DRX 9000. Are you going to feel relief immediately? Probably not. So many do, but don't count on it. Probably not. But at least you'll be able to see what it's like to have a trial. Let's just move forward. Let's say that you decide, you know what? I trust you, and I've listened to the other testimonies, because so many times people can talk to the other patients that are in our clinic, and they have free reign. Hey, ask anybody anything, and they'll let you know. They're for real, and they truly do help me. So let's say that you take that next step and you decide that you're going to move forward and you are going to get a package of spinal decompression. Well, when you come in, you're going to be on the spinal decompression table for about 25-27 minutes, and then one of our technicians are going to take you off very gently. Many times you're not able to move your legs, and that's okay. We're able to do that for you. We're here to treat you and to care for you. From there, you're going to sit down and you're going to have ice put on your injury, and we're going to put electric stim on. You're going to be there for about 8 to 10 minutes, and then you're going to go on back and see one of the doctors. Our technician will do a K laser, which is a class 4 laser. It's absolutely amazing. It takes away that inflammation. There you are going to feel immediate relief, I promise. And then of course you're going to see our doctor, and you'll get an adjustment if you care to. It's all a part of what we do here. So anyways, come on in, give us a call today, 859-278-8000. Give us an opportunity to earn your trust so that we can prove to you that we truly can heal your disc injury.
If you've been living with pain, it's time to make a change today.
Before coming into Today Disc, Bone and Joint, I was in pain sitting, standing, walking, driving. I was not eligible for surgery, and I didn't want to take drugs. And I thought I would give decompression a chance. And after about 30 days, I had dramatic improvement in my pain management. Give spinal decompression a chance. It really helped me. You don't have to live with the pain that you're living with.
Pick up the phone and give us a call to see if decompression therapy can help you.
Hello, my name is Andrew Kissel. I'm the practice manager here at Today Disc, Bone and Joint, and I wanted to take a few minutes to talk to you about some of the wonderful transformations that I've seen here in my time at the practice. So typically, a patient that comes in for spinal decompression is at the end of the line. They have had injections, they've been taking prescription medicine, they have gone to physical therapy, they've met with orthopedic surgeons, they are looking at surgery, and they don't want to have an invasive procedure, and they are looking for a second opinion and looking for something natural, and they've come to the right place. We have no drugs, no injections. It is a non-invasive procedure, and I've been here more than 5 years. I have seen hundreds of patients achieve extraordinary results. Patients come in wheelchairs, on walkers, canes, being helped in by their loved ones, and within a few weeks they're already seeing improvements. And now as the years go by, I see patients that formerly came in, they could barely stand up. They're telling me about their last vacation. They're talking about, now we're worried about our golf swing. We're things that are just so much, there's such a blessing for me to be a part of that, and it's such a great thing to come into the office and see a name on the schedule and to think about how far that patient has come and how they continue to improve and just they go on living their lives doing all the things that one is meant to do. And I'm just so grateful to have been a part of that. And I look forward to helping even more people. And if you have any questions at all and you see me, you can always pull me aside. I'm happy to answer any questions and just chat with you. Thank you.
If you've been living with pain, it's time to make a change today.
I had trouble sleeping, doing household activities, bending over. After I started the spinal decompression, almost immediately the pain in my left foot started going away. Spinal decompression at today's Disc, Bone and Joint has made a total difference in my life. The sooner you start doing something, the better.
Pick up the phone and give us a call to see if decompression therapy can help you.
I was suffering from chronic long-term back pain. Spinal decompression has been so easy. It's enabled me to do the things that I used to do and enjoy pain-free. And the staff and doctors here are fantastic.
Pick up the phone and give us a call to see if decompression therapy can help you.